Walgreens announced this morning it's closing 1,200 locations.
They are built on helping every person that walks through that door. That's why they got into business. I mean, that's why they got into pharmacy, is to help patients.
All 3 locations for Dick's Pharmacy will be shutting down.
Pharmacists are the most accessible healthcare professionals in America.
CVS Pharmacy will be closing 900 stores all over the country over the next 3 years.
About 1 in 3 U.S. pharmacies have closed since 2010, according to research from USC and UC Berkeley. Closures are affecting big-name chains and independent providers who've served communities for generations. And the real losers in all of this are the customers who rely on them.
If we keep closing these pharmacies, particularly in the rural areas, that accessibility to healthcare is going to suffer.
Americans are losing access to the first line of healthcare, and we're going to break down the reasons why. We'll show you how industry consolidation led to closures, pharmacy benefit managers, and the fallout of pharmacy deserts.
These pharmacies are still treating everybody as what? Customers. And they're not taking the success of the customers personally, and that's what's killing them.
Britton Ladd is a business strategy consultant with decades of experience.
The other problem that these pharmacy chains have is that they're bloated. They have too many stores. They have too many residual businesses, the healthcare businesses, and so forth.
National retail pharmacy chains have only gotten bigger over the decades. Walgreens started its growth campaign by purchasing a malted milkshake company owned by an employee back in 1922. Its merger with Alliance Boots, Europe's largest pharmaceutical wholesaler, made that growth international. Just this year, private equity firm Sycamore bought Walgreens for just shy of $10 billion with the intention of taking it private. Walgreens even tried to acquire Rite Aid, but regulators stopped that. By 1996, Rite Aid purchased enough regional pharmacies to reach 4,000 locations. It continued gobbling up locations in 2007, buying 1,854 Brooks & Eckerd stores, and in 2020, it bought Seattle-based Bartell Drugs. CVS picked up 2,500 Revco drugstores in 1997 and took over Target's pharmacy and health business in 2015, accounting for more than 1,600 stores. Its growth strategy also involves owning an insurance provider and a pharmacy benefit manager.
Despite the size these companies are now and the incredible amounts of money that is flowing through them, they're not making enough money to satisfy Wall Street.
Wendell Potter is a former health insurance executive turned healthcare reform advocate.
Because of that, these companies have to do even more to meet the expectations of those investors. And that means they're going to be looking at the stores to close. They're going to be looking at accounts to get rid of.
The traditional drugstore is split into 2 sections. There's the pharmacy that dispenses prescription drugs, and there's the front end that handles the retail, when you buy snacks, toilet paper, or even over-the-counter medicines like Tylenol.
And there are so many easier ways for the consumer to be able to get the pharmaceuticals they need. They can do it online. It's so easy to just go into a Target, into a Walmart, or whatever. They've just simply not been able to crack the code when it was related to retail. A lot of pharmacy companies just are not very good at retail at all.
Consolidation in this space goes well beyond just buying up your competitors, and that's where pharmacy benefit managers come in.
That's right. I'm your insurance company's pharmacy benefit manager.
A pharmacy benefit manager is a middleman between a drug manufacturer and the pharmacy, and ultimately to the patient who needs the medication.
The vertical integration has just really put kerosene on the fire. So the vertical integration was when the health insurance companies and the PBMs used to be separate, but then they merged.
You have the insurance company that owns the PBM, that owns the group purchasing organization, that owns the pharmacy, that owns the doctor.
When your competitor is deciding how much you get paid and also steering the patient into the pharmacy that your competitor wants, those are competitive disadvantages that are almost impossible to overcome.
These pharmacy benefit managers play a big role in America's drugstores, but how do they impact the everyday consumer? We'll dive into their role in part 2 of our series, The Demise of American Pharmacies.